Jim, if I can turn to you first, can you walk us through your example and experience at UPS?
Certainly. May I use the presentation for that?
Please, yeah.
Great.
And I think you should have a clicker here.
I do. All set.
And let's get your mic on.
So good morning, and we thought we would choose an example of a collaboration, and in this example, it is an implementation of a supply chain solution. Quite often it's called drones, but when you think about it, it actually is a compilation of a lot of different initiatives. And it's a partnership across 4 entities. So it's the government of Rwanda, it's a global health partner in Gavi, it's Zipline, who is the developer of the solution, and UPS, using the supply chain skill set we have to help pull all this together. So I'm going to walk you through a presentation. It's got a couple of videos in there. I'm going to read a lot because it's really, I want to make sure you get the full content of what the solution is. So we'll take it from there. So this relationship started in about 2016, and the thing that I think Zipline brought to the table is that they're an automated logistics company that designs, manufactures, and operates drones as a service to make life-saving deliveries. In late 2016, the government of Rwanda contracted with Zipline to launch the world's first national-scale drone delivery network. Rwanda is known as the land of 1,000 hills. Many of its roads are unpaved and has 2 different rainy seasons per year. The government of Rwanda asked Zipline to focus first on blood delivery because it was a critical and complex supply chain challenge. Previously, hospitals that needed blood supplies that weren't available on hand had to drive to the nearest regional blood bank, a trip that could be between 4 or 5 hours on good conditions and quite impossible under bad conditions. In response to this request, Zipline established its first distribution center, the Z on this map that you see here, and about 45 minutes west of the capital city of Kigali. From this distribution center, Zipline can serve about 2/3 of the country and include about 21 hospitals, which we call the blood drops, that the government initially contracted them to serve. And that's the plotting of the hospitals. Zipline couldn't do this alone. It was at the time, it was a small startup company, so trying to do something that had never been done before in the world. To make the vision a reality, Zipline enlisted the help of 2 organizations, both Gavi and UPS Foundation. And that's what you see here. You have the president of the foundation, you have folks from Gavi, and then you have the CEO of Zipline in this photo. So it was very well received, and I think the key piece of this thing that makes this work is the full support of the government of Rwanda. You know, we all talk about ownership, we talk about change management, but what's different here is, and when I click a button here, the gentleman that's about to launch his very first drone is President Kagame. So you can't get much better support than having the president of the country agree that this is an important initiative, and that's what's made this work really, really well. And for that kind of top-down support, we've been able to turn around and then move this thing through a pace of typical regulation, because when you think about drones, you're going to have civil aviation involved. You have to make sure that you have all the conditions for that to be approved. And from that leadership level, we talked about it in one of the breakouts yesterday, this is where this has been a very successful model.
Sir, who's the gentleman in the suit in the picture?
On the right-hand side?
Yes, our right there.
I believe it's with Zipline. So that was the first day it launched. Now, 2 years later, Zipline's aerial delivery service is routine. It's available to hospitals 7 days a week, 12 hours a day, and it's normal to see dozens of flights flying overhead on a daily basis. The service has made thousands of deliveries and flown over 500,000 kilometers and still counting. Let's see how it works. Zipline receives an order from a hospital. Our staff picks and packs the medical products and hands the package off to our flight operations team for delivery. The Zipline flight operations team loads the package into Zip, which is what we call our company's autonomous drones. When the Zip is ready to launch, we accelerate it from 0 to 100 kilometers per hour in about half a second, and from the moment it leaves the launcher, it's completely autonomous. As the Zip is nearing delivery, our system will automatically send a notification to the hospital letting them know to expect delivery. The zip descends to about 10 meters above the ground and drops the package using a simple paper parachute. While this delivery is simple, it's also safe and accurate. Zipline can accurately deliver packages to an area about the size of 2 parking spots. And it actually operates at both severe wind and rain. Then the zip will climb back up to cruising altitude and return to the Zipline distribution center to get ready for the next delivery. So how does this service fit into the country's blood supply chain? It kind of focuses on 2 cases. The first is routine resupply. This is about making sure that all the high volume products that hospitals use all the time and that they need to have on hand readily are always on the shelves and fresh. In the case of the National Blood Service, this means adult red blood cells. These are common and not used often. Hospitals are allowed to have a certain amount of stock on hand, and when their stock goes below critical levels, they order a resupply from Zipline, which is fulfilled on demand. This means they never have to worry about stockouts. And when they know that stockouts won't be an issue, they begin to see that they can reduce the inventory levels they keep on hand just in case. And I think this is what we've all seen, which is excessive management of inventory, which creates a lot of other stockout problems and expirations. So products will have a higher turnover. They need less product in the system because they have a confidence that they'll be there upon shipment. The second purpose is emergency deliveries or just-in-time deliveries. This is about recognizing that there are a lot of products in remote health facilities that either can't or shouldn't hold inventory on their shelves, but still need access to it. The products may be too scarce, expensive, or intermittent in demand. Or maybe they just require specialized storage equipment that isn't possible to have everywhere. In the case of Rwanda's blood service, these are the pediatric red blood cells, platelets, plasma, and cryoprecipitate. Apologize for my medical gap there. You probably know what that means. Mm-hmm. These products are held centrally at Zipline's distribution center in lab-quality blood storage equipment. When a doctor has a patient who needs any of these products, a special emergency order is placed through Zipline. Then these products are delivered to the health center and go directly to the operating room for transmission to the patient. More importantly, this means our customers are looking for what they need for support. This eliminates stockouts and assures 100% access to medical products while reducing waste by 98%. Typical health systems have to balance access against waste. If you stock a large amount of medical products, as I mentioned earlier, you can increase the access for patients, but also increase expirations, and vice versa. If you hold medicine back, it's possible to decrease waste, but patients may be denied care if there's a stockout. By using this instant delivery service, Rwanda broke this cycle. Because doctors now know that they can always get what they need instantly, they actually hold much less inventory at the hospitals. And this is pretty remarkable because many of the hospitals in the U.S. even struggle to do this today. As a result, the government has saved money by using Zipline services. And then simultaneously, during the first month of service, it's seen 175% increased use of platelets and plasma, which suggests there was probably a lot of latent clinical demand that wasn't being captured because of the access to the product. So the implications are clear. Our experience suggests that as products become widely available, there needs to be a coordinated effort and to disseminate knowledge on when and how to use the products. On a more human level, these statistics translate into healthy patients and happy, healthy workers. The vast majority of the blood we deliver in Rwanda goes to benefit maternal and child health, including complicated deliveries, PPH, and severe anemia due to malaria. Just this past weekend, the Rwanda Ministry of Health celebrated 3 hospitals who had 0 maternal deaths in the last 7 months. 2 of the 3 hospitals are served by Zipline. The director of one of those hospitals called out Zipline as a specific element of its success to driving deaths to 0. That hospital director knows firsthand that doctors can do the job better when they have the tools they need to save a patient. The doctor who benefited from the Zipline services report feeling more satisfied in their roles, better supported by the health system, and despite working in some of the most remote conditions and facilities in the country, which is, that's our customer when you think about it that way. So we hear stories behind the scenes all the time.
igihe kuva basaba amaraso n'igihe yatugereyeho nta minota 5 irimo.
These results have allowed Rwanda and other countries to completely reimagine the standards of care and that are possible at every level of the health center. Soon, Zipline will be delivering not just blood, but also vaccines and vital medicines. Just recently, the government has approved a second location, which is identified in the top right-hand corner of that graphic, and all the plotting of the territories it will cover. And every center will be delivered within 30 to 45 minutes in the country, no matter where they're located. And as before, UPS and Gavi have been critical partnership of the Zipline solution. And what's best served about this is that this partnership has been developed to expand. We're looking at other countries to do this in, and it's actually brought back the value of the supply chain thinking that I think was a gap in the country of Rwanda. So moving forward, we looked at urgent care. We're looking at additional products such as vaccines and vital medicines, and probably up to 1,000 SKUs will be in the network by the time we're complete with this project in Rwanda. Thank you.
Thank you, Jim. And I have to say, as someone in the community, it's something we've watched from afar with absolute joy and amazement. So thank you on behalf of all.